We are in a state of emergency. As Dr. King says, we are in the fierce urgency of now. But we have been joined today by the best our country has to offer in Black church leadership and public health and science. And in all, there is hope.
I'm grateful to be a part of this Choose Healthy Life work on COVID-19. I'm grateful that I've been a part of this effort from its inception, as we're focused on long-standing disparities in healthcare.
And now, through Choose Healthy Life, we're on the path to meet the crisis of COVID-19 in the Black community.
We must call on all sectors of society to take action. We also need to thank those who have come with us to stand in the breach. Quest Diagnostics, who have committed millions to save our people, resolved to save lives for their leadership and support, and our public health experts who are here with us today.
Infection rates are up. More people are hospitalized with COVID-19 than ever before. And just last week, we crossed that very grim milestone of 4,000 deaths in one day. And we're projecting 500,000 lives lost in the United States by February. And the impact on communities of color has been uniquely devastating on economic and health fronts. To date, 1 in every 735 Black Americans, 1 in every 1,000 Latinos, and 1 in every 595 Indigenous Americans has died of COVID-19. So while the topic of vaccination is top of mind for many, and I will touch on vaccines today, it is important that we do not take our eyes off of our efforts to expand access to testing. Tragically, too many African Americans get their first test for COVID-19 when they're getting admitted to the hospital, having missed the critical early window when some of the best treatments we have are most effective. We must get the word out about vaccination and must continue to elevate the importance of testing. We are not testing at the rates we need to be. We saw this with testing, that the distribution of resources and access was not always even. A reminder to us that equity does not happen by default.
But at this time, I want to recognize the dedicated staff of Quest Diagnostics, who've worked to ensure that we have what we need to make this initiative a success. Steve and his company are committed to making a difference in the lives of our communities. You've seen what that company has done since the beginning of the pandemic. They don't just talk the talk, they walk the walk. And they are investing dollars, manpower, and life-saving diagnostics into the program, not just for COVID, but for a wide range of health challenges that impact our community.
We actually published some research today. We did a study. And what we found in the Black and Hispanic communities throughout America, that those individuals that answered the survey, they were 2 times more likely to say they did not have good access to COVID-19 testing, vaccines, and support than other Americans. So together, we can affect this. Quest Diagnostics, unfortunately, to be representing about 50,000 people that have been hard at work fighting this nasty pandemic.
Basically, to test more, make it convenient, make sure those with symptoms get tested, make it routine, and test the contacts. That way we can stop the spread.
And the data show that Black Americans are nearly 4 times more likely to be hospitalized and nearly 3 times more likely to die from COVID-19 than their white counterparts.
If you have symptoms, there's a possibility that you are in fact infected. You should get tested, assume you're infected, and do the social distancing until you get a result.